right, we have one. This is from, I guess, a husband. He says his wife started getting dizzy sporadically after a cruise.
She saw the price tag.
Has been 7 months and no solution yet. Tried a doctor, essential oils, and rest. Do you have any suggestions?
Yeah, be careful about what cruise you go on. Okay, there are a couple things that can happen. Okay, you can end up with vestibulitis, okay, which is unusual, but it can happen. Actually, it happens rather commonly, but it shouldn't follow a cruise unless the cruise is a spurious event or a coincidence. If it's vestibulitis, there are a couple things you need to do, one of which is to avoid or limit caffeine intake and salt intake. If you do that, you take a mild diuretic, and if the dizziness starts to get better, then you're going to know pretty much what you have there is benign vertigo or benign dizziness, essentially. Okay, why? This is the way that it works, and you can take a mild diuretic and straighten this out also. It's part of the experiment here would be to get parsley flakes, dried parsley. Again, you can get this at Publix, okay? And you make up tea with it. You take a tablespoon, make up tea with it, strain the parsley out or use a tea strainer, and then add a little bit of honey to it because it tastes terrible if you don't. And then you'll pee off a good bit of fluid. When you do that, if the dizziness gets better, bingo, away you go. And the same thing is true with tinnitus when it's due to this type of fluid overload. Now, what else could have done it? Okay, well, she may well have a vascular issue. Okay, sometimes that'll happen. You're on a boat. You're there to relax and so on and so forth. Now you'll start noticing things that you wouldn't otherwise notice. But the most likely possibility is going to be fluid retention due to salt and/or caffeine overload.